Traces of Trauma, Unveiling Global Experiences of Pain, Resilience, and Healing. Copyright symbol July 2023. Dictated to ChatGPT by Glow. Introduction. Explanation of the book's purpose and goals. In an era of increasing global connectivity, where information and experiences can be shared at the speed of light, it has become ever more critical to recognize and understand the different forms of suffering that affect individuals and communities worldwide. Trauma, an often invisible yet indelible mark left by experiences of intense fear, threat, or harm, is a universal part of the human experience. However, its manifestations, effects, and our responses to it are as diverse as we are. This book, Traces of Trauma, Unveiling Global Experiences of Pain, Resilience, and Healing, is a journey through the complex landscape of trauma, exploring its many faces, impacts, and the pathways towards healing. Our goal is not merely to illuminate the dark corners of human suffering, but to underscore the immense capacity for resilience and recovery in the face of such adversity. We aim to unravel the complex tapestry of trauma, spanning from personal experiences of fear and pain to the collective agonies endured by communities, and even entire races or cultures, over generations or in the face of historical atrocities. We will delve into a myriad of trauma types: historical, collective, intergenerational, personal, and structural or systemic. Each one, though experienced differently across contexts and individuals, leaves its distinct imprint, shaping lives in profound ways. We will explore these through a blend of research, case studies, and personal narratives. We'll strive to highlight not only the enduring impact of these traumas but also the many ways individuals and communities find to heal, recover, and grow in their aftermath. This exploration is also an homage to human resilience, a trait as universal as trauma, but far more uplifting in its implications. Lastly, this book seeks to be more than just an exposition of pain and resilience. It is a call to empathy, understanding, and action. By making visible the invisible traces of trauma, we aim to inspire our readers to challenge stigmas around mental health, to foster conversations that can lead to healing, and to instigate change at both the personal and systemic levels. In our exploration of trauma, its many manifestations, and its equally varied forms of resilience, we hope to offer a holistic, empathetic, and enlightening perspective that will inform, challenge, and inspire. In doing so, we hope to honor the complex realities of those living with the legacy of trauma, while also illuminating the path towards healing and growth that lies within every individual's reach. So, let us embark on this journey together, through the valleys of pain and up the mountains of resilience, tracing the indelible yet transformative footprints of trauma in our shared human experience. Definition and explanation of key terms: trauma, PTSD, resilience, etc. Key terms: understanding trauma, PTSD, and resilience. To fully grasp the depth of the topics we will be exploring in this book, we must first lay a foundation by defining a few crucial terms. These concepts, trauma, PTSD, and resilience, will act as signposts guiding our journey. Trauma. In psychological terms, trauma is a response to an intensely distressing event or series of events that overwhelms an individual's ability to cope, induces feelings of helplessness, diminishes their sense of self and their ability to feel a full range of emotions and experiences. These events are typically perceived as threatening to life, bodily integrity, or sanity. Trauma can result from a single event, a series of events, or a set of enduring conditions. The effects of trauma can be immediate or delayed, and they can persist for many years after the traumatic events have ended. Symptoms often include flashbacks or intrusive thoughts, avoidance behaviors, negative changes in mood and cognition, and alterations in arousal and reactivity. PTSD, post-traumatic stress disorder. PTSD is a specific psychiatric disorder that may occur in people who have experienced or witnessed a traumatic event. Not everyone who experiences trauma develops PTSD. However, for those who do, the symptoms can be debilitating. These symptoms include, but are not limited to, persistent and intrusive memories of the event, flashbacks, nightmares, and severe emotional distress or physical reactions to reminders of the event. PTSD is unique among psychiatric diagnoses because of the great importance placed upon the etiological agent, the traumatic stressor. In other words, a specific event or series of events must have occurred and been followed by a specific spectrum of symptoms, for a diagnosis of PTSD to be made. Resilience. Resilience represents the process and outcome of individuals adapting well in the face of adversity, trauma, tragedy, or significant sources of stress. It doesn't mean that individuals don't experience any distress, pain, or disruption after these experiences, but rather, they use both internal strengths and external resources to rebound. Resilience is not a trait that people either have or do not have. It involves behaviors, thoughts, and actions that can be learned and developed by anyone. Factors contributing to resilience can be individual, such as positive coping skills and optimism, relational, like supportive relationships, or contextual within one's environment, such as access to necessary resources. Understanding these terms and their interconnections forms the cornerstone of our exploration into the global experiences of trauma and healing. We will delve deeper into each of these concepts throughout the book, applying them to real-world experiences and examples to illuminate their complexity and impact. Overview of the book's structure. Our journey through traces of trauma, unveiling global experiences of pain, resilience, and healing is organized into a series of interconnected chapters, each shining a light on different facets of trauma and resilience. While each chapter stands as its own exploration, together they form a comprehensive exploration of our topic. In Chapter 1, The Anatomy of Trauma, we start with a foundational understanding of trauma itself, its types, and the impact it has on mind and body, including the role of memory and the development of post-traumatic stress disorder. Chapters 2 to 6 delve into different types of trauma. In Chapter 2, Historical Trauma, we look at the lasting impacts of major historical atrocities on the communities that experienced them. Chapter 3, Collective Trauma, broadens our perspective to societal events that affect groups on a large scale, such as wars, pandemics, or natural disasters. In Chapter 4, Intergenerational Trauma, we delve into the transmission of trauma effects across generations. Chapter 5, Personal Trauma, brings our focus to the individual level, exploring personal experiences of trauma from accidents, abuse, or violence. In Chapter 6, Structural / Systemic Trauma, we examine the often invisible trauma caused by systemic oppression and discrimination. Chapter 7, Trauma and Resilience, represents a turning point in our narrative. Here, we focus on the powerful capacity of individuals and communities to recover and even grow in the aftermath of trauma, weaving together research and inspiring real-world examples of resilience. In Chapter 8, Healing from Trauma, we explore the many paths to recovery from trauma. We delve into various therapeutic approaches, community healing practices, and the role of social support, activism, and policy change in healing and preventing trauma. In our conclusion, we revisit the key themes and learnings from each chapter, reflecting on the importance of understanding and addressing trauma, and celebrating the incredible strength and resilience demonstrated by trauma survivors around the world. Finally, in our appendix / resource guide, we provide a list of books, articles, organizations, and other resources for those who want to continue learning about trauma and resilience or who need support in their personal journey of healing. This structure allows us to explore our complex topic from multiple angles, using a blend of research, case studies, and personal narratives. By delving into both the darkness of trauma and the light of resilience, we aim to provide a balanced, comprehensive, and ultimately hopeful perspective on these critical aspects of the human experience. Chapter 1: The Anatomy of Trauma. Understanding trauma, what it is and how it impacts the mind and body. Before we embark on our journey through the complex landscape of trauma, we must first understand what trauma is at its core, and how it etches its mark on the mind and body. The term trauma originates from the Greek word for wound. In a psychological context, trauma refers to a deeply distressing or disturbing experience that overwhelms an individual's ability to cope, often inducing feelings of helplessness and fear, and causing potential changes to cognitive, emotional, and physical functioning. This could be the result of a singular event, such as a violent assault, or an enduring circumstance, like living in a war-torn region. Trauma is subjective and deeply personal. An event that may be traumatic for one person may not be so for another. The critical factor lies in the individual's experience of the event or circumstance. If they perceive it as life-threatening, extremely upsetting, or painful, it can lead to trauma. The effects of trauma extend beyond the psychological realm, impacting physical health as well. When we experience traumatic events, our bodies go into a fight or flight response, releasing stress hormones like adrenaline and cortisol. While these reactions are helpful in the short term, helping us to react and survive threatening situations, their prolonged activation, as seen in ongoing trauma, can have detrimental effects on the body. The lingering impact of trauma can manifest as changes in the brain structure and function. For instance, the amygdala, responsible for identifying threats and triggering fear responses, may become overactive, making individuals more responsive to stress. The prefrontal cortex, which helps us to think logically and control our reactions to fear, may decrease in volume, making it harder to regulate fear responses. Furthermore, the hippocampus, which helps in forming memories, can also be affected, leading to difficulties in remembering the traumatic event or fragmentary and intrusive memories. Trauma can also affect the body, leading to chronic pain, sleep disturbances, and changes in appetite. It can also increase the risk of developing physical health problems such as heart disease, diabetes, and immune-related disorders. However, the impact of trauma is not a life sentence. With the right help and support, individuals can heal from trauma, and in some cases, even experience growth that can lead them to a higher level of functioning than before the traumatic event. This phenomenon, known as post-traumatic growth, underscores the human capacity for resilience and will form a key theme in our exploration of trauma and healing. Understanding the anatomy of trauma gives us a lens to examine the diverse and complex experiences we will explore in the following chapters. As we delve into these narratives of pain, resilience, and healing, let this foundational understanding of trauma guide our journey, enrich our understanding, and inspire empathy and compassion. Different types of trauma: acute, chronic, complex. As we delve deeper into understanding trauma, it's important to note that it doesn't come in one size. Trauma is not a monolith but rather a term that encapsulates various experiences and their impacts. To navigate this landscape, professionals have classified trauma into several types, primarily acute, chronic, and complex. Acute trauma usually results from a single incident that is limited in time. This might be a car accident, a natural disaster, an act of violence, or any other distressing event that poses a severe threat to a person's physical or emotional well-being. Acute trauma can lead to a wide range of emotional and physical reactions, such as shock, disbelief, nightmares, anxiety, and difficulty sleeping, among others. Even though the event is limited in time, the psychological effects can extend far beyond the incident itself. Chronic trauma, on the other hand, refers to repeated and prolonged exposure to highly stressful events. Examples of this might include ongoing physical or sexual abuse, living in a war-torn region, or enduring persistent bullying. The impact of chronic trauma can be more severe than acute trauma due to its enduring nature, with victims often experiencing severe emotional distress, feelings of hopelessness, chronic anxiety, and even symptoms of PTSD. Complex trauma, a term developed by trauma experts in the 1990s, refers to a type of trauma that occurs repeatedly and cumulatively, usually over a period of time and within specific relationships and contexts. This includes experiences of multiple traumatic events or types of maltreatment, interpersonal violence or abuse, within the caregiving system or social environment. The effects of complex trauma are often more extensive than those of acute or chronic trauma, and can include difficulties with emotion regulation, consciousness and memory, self-perception, relationships with others, and distorted perceptions of the perpetrator of the abuse. Understanding these different types of trauma helps us appreciate the diverse ways in which traumatic events can impact individuals and communities. It underscores the fact that trauma is not a singular experience, but a spectrum of distressing experiences that can have a wide range of effects on those who endure them. As we explore various manifestations of trauma in the following chapters, we will often return to these classifications to help provide context and deeper understanding. Remember, every traumatic experience is unique to the individual, and these categories are not meant to box in experiences, but rather to provide a framework for understanding and processing them. Trauma and memory. One of the most challenging aspects of understanding and navigating trauma is its profound impact on memory. Trauma doesn't just linger in our emotional responses, it leaves indelible marks on our memories, shaping how we recall and process our experiences. Memory is not a singular, unified process. Instead, it is made up of multiple systems, each responsible for different types of remembering. For example, explicit memory allows us to consciously recall past events, while implicit memory, which often operates below the level of consciousness, influences our behavior based on past experiences. In traumatic situations, our memory processing can become disrupted. This is due to the intense stress response triggered by traumatic events, which can affect the hippocampus, a brain region crucial for memory formation and organization. This may result in difficulties with explicit memory related to the trauma, including fragmentary and disorganized recall, or even gaps in memory. In contrast, traumatic experiences can become powerfully encoded in implicit memory, influencing emotions and behaviors outside of conscious awareness. This can lead to experiences of being triggered by stimuli that are reminiscent of the trauma, causing intense emotional and physiological reactions, or even flashbacks. In the case of post-traumatic stress disorder, PTSD, individuals often experience intrusive memories or flashbacks where the traumatic event is relived, and it feels as if it is happening all over again. These are not ordinary memories, but rather intense, often sensory-laden re-experiencing of the traumatic event. Furthermore, trauma can also impact prospective memory, our ability to remember to perform actions in the future. Research suggests that individuals with PTSD may have difficulties with prospective memory, which can impact day-to-day functioning and quality of life. Understanding the interplay between trauma and memory is crucial for both survivors and those who support them. It can illuminate why survivors may struggle with memory issues, react strongly to certain triggers, or have difficulty managing future-oriented tasks. This knowledge is also foundational to many therapeutic approaches, which aim to help individuals process traumatic memories and reduce their emotional intensity. Remember, the impact of trauma on memory underscores the pervasive nature of trauma, and reminds us that recovery involves not just the mind or the body, but the complex interplay between the two. As we continue to explore the diverse experiences of trauma in the chapters ahead, keep in mind the intricate dance between trauma and memory, a silent choreography that shapes the survivor's journey towards healing. PTSD, causes, symptoms, and treatments. Post-traumatic stress disorder, or PTSD, is a psychological condition that can occur in individuals who have experienced or witnessed a traumatic event such as a natural disaster, a serious accident, a terrorist act, war/combat, rape, or other violent personal assault. It's a complex disorder, and understanding its causes, symptoms, and treatments is a crucial part of our exploration of trauma. Causes. PTSD is not caused by the traumatic event itself, but by the individual's unique response to the trauma. Not everyone who experiences trauma will develop PTSD. It's believed that a combination of factors contribute to its development, including the individual's personal history, genetic predisposition, the nature and intensity of the trauma, and their coping skills and support network after the trauma. Symptoms of PTSD generally start within a month of the traumatic event but may not appear until months or even years later. They are usually grouped into 4 types. 1. Intrusion symptoms, such as recurrent, unwanted distressing memories of the traumatic event, flashbacks, nightmares, or severe emotional distress or physical reactions to reminders of the trauma. 2. Avoidance symptoms, such as avoiding people, places, activities, objects, and situations that bring on distressing memories. People with PTSD may also avoid thoughts or feelings related to the traumatic event. 3. Negative changes in thinking and mood, such as negative thoughts about oneself or the world, hopelessness about the future, memory problems, difficulty maintaining close relationships, or feelings of detachment from family and friends. 4. Changes in physical and emotional reactions, also called arousal symptoms, such as being easily startled or frightened, self-destructive behavior, trouble sleeping or concentrating, or overwhelming guilt or shame. Treatments. The primary treatments for PTSD are psychotherapy, medication, or a combination of the two. Psychotherapy, or talk therapy, involves meeting with a mental health professional. Specific types of psychotherapy used for treating PTSD include cognitive therapy, exposure therapy, and eye movement desensitization and reprocessing, EMDR. Cognitive therapy helps individuals understand and change thought patterns leading to problematic feelings, thoughts, and behavior. Exposure therapy helps individuals face and control their fear by exposing them to the trauma they experienced in a safe way. EMDR combines exposure therapy with a series of guided eye movements that help process traumatic memories and reduce their power. Medications, such as selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are often effective in treating PTSD. These medications can help control PTSD symptoms such as sadness, worry, anger, and feeling emotionally numb. It's important to note that there's no one-size-fits-all treatment for PTSD, and different people will respond to different treatments. That's why a treatment plan for PTSD should always be created in collaboration with a mental health professional and tailored to the individual's specific needs and symptoms. Understanding PTSD in the context of trauma helps us recognize the prolonged impact that distressing experiences can have on a person's life. It highlights the necessity for proper support and treatment for those affected, providing them the means to reclaim their lives from the clutches of trauma. It's a testament to our inherent resilience and capacity for healing, themes that will recur as we delve deeper into our exploration of trauma. Chapter 2: Historical Trauma. Defining historical trauma. While the concept of individual trauma is fairly well known, the notion of historical trauma might be less familiar. Yet, it is equally significant and pervasive in shaping the experiences and well-being of communities around the world. Historical trauma refers to the cumulative emotional and psychological wounding of an individual or generation caused by a cataclysmic event or a long-term series of events. This trauma is not only carried by individuals directly experiencing it but is passed down across generations, resulting in a legacy of suffering that extends far beyond the initial traumatic events. Historical trauma is often experienced by specific cultural, racial, or ethnic groups. Examples include the colonization and systemic genocide of indigenous peoples, the transatlantic slave trade and subsequent racial oppression faced by African Americans, the Holocaust experienced by Jewish people, and many more. These collective traumas have profound effects on the mental and physical health of the populations affected, both at the time of the events and for generations that follow. These traumatic experiences don't just fade away with time. Instead, they leave indelible imprints on the collective memory of these communities, influencing cultural practices, individual identities, community structures, and collective health outcomes. Importantly, the consequences of historical trauma can be observed not only in psychological symptoms such as increased rates of depression, anxiety, and post-traumatic stress disorder, PTSD, but also in broader health outcomes. Research has linked historical trauma to elevated rates of substance abuse, diabetes, and other chronic diseases within affected populations. Understanding historical trauma is vital for any comprehensive exploration of trauma at large. It illuminates how trauma can ripple through time, affecting not just those who directly experienced traumatic events but their descendants as well. As we delve into historical trauma, we will not only examine the traumatic events themselves, but also their enduring effects on communities and individuals today, and the resilience and strength these groups have shown in the face of such adversity. Case studies: slavery, the Holocaust, indigenous genocides, etc. Slavery. Historical trauma is particularly apparent in the experience of African Americans. The transatlantic slave trade involved the violent removal of millions of Africans from their homelands, followed by centuries of enslavement, abuse, and dehumanization. The trauma didn't end with the abolition of slavery, as African Americans continued to face systemic racism, segregation, and violence, a legacy that persists to this day in the form of racial discrimination and social inequalities. The repercussions of this historical trauma are profound, influencing community health, social dynamics, family structures, and individual mental health outcomes among African Americans. The Holocaust. The Holocaust represents one of the most horrific examples of historical trauma in the 20th century. 6 million Jews were systematically murdered by the Nazis during World War II, an event that left an indelible mark on the global Jewish community. Survivors and their descendants often grapple with the trauma of this genocide, manifesting in what's known as transgenerational trauma. Survivors often suffered from PTSD, anxiety, and depression, and research indicates that their children and grandchildren may also experience higher levels of psychological distress. Indigenous genocides. Historical trauma has deeply affected indigenous peoples across the globe, from the Native American tribes in the United States to Aboriginal communities in Australia. For these populations, historical trauma stems from colonization, forced removal from ancestral lands, cultural genocide, and intentional disease introduction. The traumatic impact has spanned generations, resulting in a higher prevalence of mental health issues, substance abuse, and chronic diseases among indigenous populations. It's also led to cultural dislocation, the loss of languages and traditional knowledge, and ongoing struggles for sovereignty and cultural identity. These case studies illustrate how historical trauma operates. The original events are harrowing, but it's their long-term, multi-generational impact that truly characterizes historical trauma. Yet, while these histories are marked by deep pain and suffering, they are also marked by resilience, survival, and the ongoing struggle for justice and healing. The exploration of these historical traumas is not only a study of the inflicted atrocities but also a testament to the indomitable spirit of these communities. The lasting impacts of historical trauma on communities today. Historical trauma, while rooted in the past, has a profound and ongoing impact on the present. Its effects are not confined to the individuals who originally experienced the traumatic events but reverberate through generations, influencing communities on multiple levels. Let's explore some of the key ways in which historical trauma continues to affect communities today. Mental health outcomes. The psychological consequences of historical trauma are significant. Higher rates of mental health disorders, including depression, anxiety, and PTSD, are observed in populations affected by historical trauma. This elevated psychological distress can be linked directly to past traumas and their societal repercussions. The stigma surrounding mental health in many of these communities can further exacerbate these issues, often creating barriers to seeking and receiving mental health care. Physical health outcomes. Historical trauma is also associated with poorer physical health outcomes. The chronic stress of racism and social disadvantage can lead to a wide range of health problems, including heart disease, diabetes, and shortened life expectancy. These health disparities are not just the result of socioeconomic factors, they also reflect the physiological toll of intergenerational trauma. Social and economic disparities. The social and economic effects of historical trauma are pervasive. Communities affected by historical trauma often experience higher rates of poverty, unemployment, and educational disadvantage. These issues are not unrelated to trauma, they are, in many ways, its direct outcomes. Systemic racism, discrimination, and marginalization, all aspects of historical trauma, play a substantial role in creating and maintaining these disparities. Cultural impact. Historical trauma has profound impacts on the culture of affected communities. It can lead to the loss of language, disconnection from cultural practices, and shifts in family structures. It also often results in a collective sense of grief and loss within the community. Yet, it's within culture that resilience is often found, as traditions, stories, and communal bonds provide sources of strength, resistance, and healing. Resilience and growth. Despite the undeniable hardships associated with historical trauma, affected communities are not defined solely by their suffering. They also demonstrate remarkable resilience and capacity for growth. This is evident in movements for social justice, efforts to reclaim and revitalize cultural practices, and the everyday strength displayed by individuals within these communities. Understanding the lasting impacts of historical trauma is not just about recognizing the deep pain and injustices that these communities have faced. It's also about acknowledging their resilience, celebrating their survival, and supporting their ongoing struggle for healing and justice. As we continue to explore trauma, we must keep in mind both the suffering inflicted by these traumatic histories and the incredible strength of those who carry their legacy. Chapter 3: Collective Trauma. Defining collective trauma. Collective trauma refers to the shared psychological reactions within a population to distressing events that disrupt the fabric of society. It involves the shared emotional and psychological effects of disruptive events that impact not only individuals but also social relationships, communal systems, and cultural identity. Examples of events that can lead to collective trauma include wars, terrorist attacks, natural disasters, pandemics, or societal events such as political upheaval. Such events shake the core of communities and societies, resulting in collective grief, anxiety, and sometimes drastic changes in collective behavior and societal norms. Collective trauma differs from individual or historical trauma in its immediacy and scale. While historical trauma refers to cumulative psychological harm over generations, collective trauma is a response to an event or series of events that occur within a relatively short time frame and affect a large population simultaneously. It is not restricted to any specific group but impacts an entire society or community, leading to a collective experience of distress, fear, or loss. Collective trauma can have far-reaching impacts. It can reshape the collective consciousness, impact public discourse, influence political dynamics, and change social norms. Yet, it can also lead to increased social cohesion, as shared adversity can strengthen community bonds, increase solidarity, and inspire collective action. As we delve into the concept of collective trauma, we will explore its unique characteristics, its effects on societies, and the resilience of communities in the face of shared adversity. We will also examine case studies that illustrate the profound ways in which collective trauma can shape societies and human experience. Case studies: wars, pandemics, natural disasters, societal violence. To fully grasp the concept and impacts of collective trauma, let's delve into some case studies that represent diverse types of events triggering such trauma. Wars. The collective trauma of war is well documented. Wars affect not only the soldiers fighting on the front lines, but also entire societies back home. World War I and II left profound psychological scars on the nations involved. In addition to the loss of millions of lives, the disruption, and the physical destruction, these wars challenged society's collective sense of security and trust. They also reshaped national identities, impacted societal norms, and triggered significant political changes. Pandemics. The COVID-19 pandemic is a recent and prime example of a health crisis leading to collective trauma. The virus not only took millions of lives globally but also disrupted daily routines, livelihoods, and social relationships. It created a shared sense of vulnerability and uncertainty that has affected mental health on a global scale. The pandemic's legacy continues to impact societies through an increased sense of anxiety, a collective grieving process, and the reshaping of societal norms around health and interpersonal interaction. Natural disasters. Events such as earthquakes, tsunamis, hurricanes, and wildfires can inflict collective trauma on affected communities. The 2010 earthquake in Haiti, the 2004 Indian Ocean tsunami, and the ongoing impact of climate change-induced disasters are instances where natural calamities have caused widespread loss and trauma. Such events result in immediate distress and long-term psychological impact, disrupting communities and requiring significant efforts at rebuilding and healing. Societal violence. Acts of societal violence, such as mass shootings or terrorist attacks, can also lead to collective trauma. The 11th of September attacks in the United States, for instance, resulted in a shared sense of fear, vulnerability, and grief that extended far beyond the individuals directly affected. Such events can lead to societal changes in security measures, increased prejudice or fear towards certain groups, and shifts in national consciousness. These case studies offer a glimpse into the multifaceted nature of collective trauma. They underscore the wide-reaching impact that certain events can have on the collective psyche, social structures, and cultural norms of societies. Understanding these dynamics is essential in acknowledging collective suffering, facilitating communal healing, and building societal resilience in the face of future adversities. The role of media and collective memory in collective trauma. Media and collective memory play crucial roles in shaping, preserving, and transmitting collective trauma. They contribute to the construction of the collective narrative around the traumatic event, influencing how societies understand, react to, and remember these experiences. The media plays a central role in informing the public about traumatic events, framing the narrative, and shaping the collective response. Through newspapers, television broadcasts, social media platforms, and more, the media conveys information, images, and stories that shape the public's understanding of the event. However, the way the media portrays these events can have significant implications. Sensationalized or graphic coverage can heighten collective distress and fear, while a lack of coverage or misrepresentation can contribute to a sense of invisibility or invalidation among affected populations. Conversely, the media can also play a positive role in the aftermath of collective trauma. Accurate, respectful reporting can foster understanding, empathy, and solidarity, both within the affected community and beyond. Media platforms can also provide spaces for collective mourning, shared resilience, and communal support. Collective memory refers to the shared pool of memories, knowledge, and interpretations of the past within a group, society, or culture. It is a dynamic process, shaped by current societal attitudes, beliefs, and values. Collective trauma often becomes a part of a society's collective memory. Commemorations, public rituals, monuments, and historical narratives all contribute to the construction of collective memory around traumatic events. Collective memory plays a vital role in shaping the ongoing impact of collective trauma. It can perpetuate the trauma, particularly if the memories are of unresolved violence, injustice, or loss. However, it can also promote healing and resilience by fostering a shared understanding of the past, maintaining the memory of lost loved ones, acknowledging suffering, and commemorating collective strength and survival. In essence, the media and collective memory are key actors in the narrative of collective trauma. They not only reflect the collective experience of trauma but actively shape its course, influencing societal responses, healing processes, and the long-term impact of the traumatic event. Chapter 4: Intergenerational Trauma. Definition and exploration of intergenerational trauma. Intergenerational trauma, also known as transgenerational trauma, refers to the transmission of trauma from the first generation of trauma survivors to the subsequent generations. This type of trauma is not experienced by the later generations directly but is passed on in various ways, including through genetic changes, altered parenting behaviors, and social circumstances. The origins of intergenerational trauma can be traced back to any form of severe stress or trauma experienced by the first generation, including war, genocide, enslavement, or personal traumas such as domestic violence. While the subsequent generations may not have directly experienced the original traumatic events, they carry the emotional and psychological effects of those events, often manifesting as PTSD, depression, anxiety, and other mental health disorders. Unlike historical trauma, which focuses on trauma inflicted on a large group across generations, intergenerational trauma emphasizes the transmission of trauma within families from parents to children. It can occur within any family or community, regardless of the specific traumatic events their ancestors have faced. Several mechanisms have been proposed to explain the transmission of intergenerational trauma. These include: 1. Biological transmission. Traumatic experiences can alter the expression of genes, a phenomenon known as epigenetic changes. These changes, affecting stress responses and mental health, can potentially be passed down to offspring. 2. Parenting practices. Trauma can influence parenting behaviors and family dynamics. Parents who have experienced trauma may suffer from mental health problems, which can affect their parenting skills, attachment styles, and the emotional environment they create for their children. 3. Social and cultural transmission. The social and cultural contexts in which children are raised also play a role. The collective memories, narratives, and norms within a family or community can perpetuate the effects of past traumas. Understanding intergenerational trauma is crucial in breaking the cycle of trauma and aiding healing processes. It requires a sensitive and comprehensive approach that recognizes the complex ways in which past traumas continue to affect present and future generations. In this chapter, we will further explore the concept of intergenerational trauma, delve into its mechanisms, and discuss approaches to healing and resilience. How trauma can be inherited, psychological and possibly biological perspectives. The transmission of intergenerational trauma is a complex process that involves both psychological and biological mechanisms. While our understanding of these processes continues to evolve, current research suggests that trauma can be inherited through a combination of altered parenting behaviors, socio-cultural factors, and changes in gene expression. Psychological transmission. The psychological transmission of trauma primarily occurs through parenting practices and family dynamics. Parents who have experienced trauma, particularly if it's unresolved, can unknowingly transmit their distress to their children. This can happen in several ways. 1. Attachment and relationship patterns. Trauma can influence a parent's ability to form secure attachments, which can lead to difficulties in their children's emotional regulation and social relationships. 2. Modeling and social learning. Children learn how to cope with stress and navigate the world by observing their parents. If a parent uses maladaptive coping strategies due to their trauma, their children may learn and internalize these behaviors. 3. Overdisclosure or silence about trauma. Sometimes, parents may share traumatic histories with their children in inappropriate ways, either by overdisclosing graphic details or maintaining complete silence, both of which can affect the children's psychological well-being. Biological transmission. From a biological perspective, the concept of epigenetics provides an explanation for the transmission of trauma across generations. Epigenetics refers to changes in gene activity that do not involve alterations to the genetic code but still get passed down to subsequent generations. Exposure to traumatic stress can lead to epigenetic changes, influencing how genes related to stress response and mental health are expressed. These changes can potentially be passed down to offspring, predisposing them to certain mental health disorders or alterations in stress responses. For instance, research has shown that children of parents who have experienced significant trauma, such as Holocaust survivors, have different epigenetic markers related to stress regulation, indicating that trauma's impact can indeed span generations. Socio-cultural transmission beyond the family unit. The broader socio-cultural context also plays a role in the transmission of trauma. Narratives, collective memories, cultural practices, and social structures related to past traumas can perpetuate the effects of those traumas within communities. In sum, the inheritance of trauma involves complex interplays between psychological processes, biological factors, and socio-cultural influences. Understanding these processes can help in developing targeted interventions to interrupt the cycle of trauma and promote healing and resilience. Case studies from different communities around the world. To comprehend the dynamics and impacts of intergenerational trauma more fully, let's consider several case studies from various communities globally. Indigenous peoples of North America. The experiences of indigenous peoples in North America exemplify the transmission of intergenerational trauma. The collective memory of colonization, forced assimilation, residential schooling, and cultural erasure continues to impact these communities. The effects are manifested in high rates of mental health issues, substance abuse, and suicide among indigenous populations. The struggle for recognition, rights, and healing remains ongoing. Descendants of Holocaust survivors. Research on descendants of Holocaust survivors has significantly contributed to our understanding of intergenerational trauma. Studies have found increased rates of PTSD, anxiety, and depression among second-generation survivors, demonstrating the long-term effects of such immense historical trauma. The epigenetic changes related to stress responses found in these populations have fueled further inquiry into the biological aspects of trauma transmission. Armenians and the genocide trauma. Armenians worldwide carry the collective memory of the Armenian genocide of 1915. Despite the denial or lack of acknowledgement by certain entities, the trauma remains alive in Armenian families through narratives, cultural practices, and public commemorations. The trauma has impacted the Armenian identity and diaspora community, influencing their collective consciousness and coping strategies. Japanese American internment. The internment of Japanese Americans during World War II represents another case of intergenerational trauma. Forced removal and internment led to significant disruption, loss, and trauma. Subsequent generations have grappled with this history, experiencing secondary traumatic effects, identity issues, and the ongoing fight for recognition and reparations. Rwandan genocide. The aftermath of the 1994 Rwandan genocide presents a case of intergenerational trauma within a relatively recent time frame. Children born to survivors or conceived as a result of war rape face unique challenges. The trauma has affected family dynamics, mental health, and community cohesion, while collective initiatives for reconciliation and healing continue. These case studies highlight the diversity and complexity of intergenerational trauma experiences. They underscore the profound influence of past traumas on present and future generations, as well as the resilience of these communities in navigating the path towards healing. Chapter 5: Personal Trauma. Understanding personal trauma, accidents, abuse, violence. Personal trauma refers to an individual's direct experience of a deeply distressing or disturbing event. This form of trauma differs from collective, historical, or intergenerational trauma in that it is individually experienced and can occur at any point in an individual's life. Personal trauma is often categorized into two types, acute and chronic. Acute personal trauma results from a single incident that is confined to a specific time and place, such as a natural disaster, accident, or violent attack. The traumatic event is usually unexpected and may pose a threat to the individual's life or physical integrity. It often results in feelings of intense fear, horror, or helplessness. Chronic personal trauma, on the other hand, is the result of repeated and prolonged exposure to highly stressful events. This can include ongoing child abuse, domestic violence, or living in a war-torn region. Chronic trauma can be especially harmful as the ongoing nature of the stress can make it difficult for the individual to recover and move beyond the traumatic experiences. Accidents, such as car crashes, falls, or severe burns, can lead to personal trauma. The sudden and often violent nature of these incidents can leave individuals with physical injuries and emotional wounds. They may relive the accident through intrusive memories or nightmares, experience a persistent fear of the event recurring, or feel a general sense of unease and hypervigilance. Abuse, whether it's physical, sexual, or emotional, often results in severe personal trauma. The violation of trust, the feeling of powerlessness, and the harm inflicted can lead to long-lasting psychological impact. Survivors of abuse may struggle with self-esteem, develop unhealthy coping mechanisms, and experience difficulties in forming safe and trusting relationships. Experiences of violence, such as assault, mugging, or witnessing a violent act, can also result in personal trauma. The shock, fear, and threat to personal safety can cause profound psychological distress. The trauma can manifest in various ways, including heightened fear and anxiety, avoidance of places or situations that remind the individual of the event, and intrusive thoughts or flashbacks. Understanding personal trauma is crucial in providing appropriate support and treatment. It's important to remember that everyone's response to trauma is unique and influenced by various factors, including their personal history, coping skills, and the nature of the traumatic event. In the following sections, we will explore the impacts of personal trauma on mental health and discuss strategies for recovery and resilience. Case studies: Personal narratives of trauma and healing. Personal narratives of trauma and healing offer invaluable insights into the human capacity for resilience in the face of adversity. Here, we present several case studies that highlight different aspects of personal trauma and the journey towards healing. Case Study 1: Surviving a violent assault. Our first narrative comes from John, who survived a violent mugging in his hometown. The assault left him with both physical injuries and emotional scars, including symptoms of post-traumatic stress disorder, PTSD. He grappled with intrusive flashbacks, heightened anxiety, and avoidance behaviors. With the support of a skilled therapist, he began to process his trauma through cognitive behavioral therapy, CBT, and gradually reclaimed his sense of safety and confidence. John's story underscores the debilitating impacts of violent crime and the potential for recovery with appropriate treatment and support. Case Study 2: Healing from childhood abuse. Maria experienced severe emotional and physical abuse throughout her childhood. The chronic nature of this trauma deeply impacted her self-esteem and mental health, leading to depression and complex PTSD. As an adult, Maria sought help from a trauma-informed therapist and began the long journey of healing. This involved processing her traumatic memories, challenging her self-perceptions, and developing healthier coping mechanisms. Maria's narrative provides a poignant insight into the long-term effects of child abuse and the strength and persistence needed for healing. Case Study 3: Overcoming the trauma of a car accident. Our final case study tells the story of Hiroshi, who experienced a major car accident that left him with a traumatic brain injury. Beyond his physical recovery, he also faced the emotional trauma of the event. He wrestled with fear, nightmares, and a resistance to driving or even being in a car. Through a combination of exposure therapy and mindfulness practices, Hiroshi learned to manage his anxiety and regain his independence. His story illuminates the challenges of healing from an accident and the role of targeted therapies and self-compassion in this process. Each of these stories offers a window into the personal experiences of trauma survivors. While the journey is undoubtedly fraught with difficulty, these narratives also highlight the potential for healing and growth following trauma. As we explore further in this book, trauma does not have to be a life sentence. With appropriate support, resources, and personal resilience, healing is attainable. Trauma's impact on identity and personal growth. Trauma is not just an event, it is an experience that can significantly impact one's sense of self and personal growth. It has the power to redefine one's identity, worldview, and life trajectory. However, this transformation is not necessarily negative. While trauma often brings suffering, it can also be a catalyst for profound personal growth and change, a process often referred to as post-traumatic growth. Impact on identity. Following a traumatic event, an individual's self-perception and identity can be significantly altered. Their sense of safety, security, and predictability in the world may be disrupted, which can lead to a shift in their self-concept. For some, the trauma becomes a defining part of their identity. They may view themselves as a victim or a survivor. This change in identity can affect all aspects of their life, from personal relationships to career choices. Moreover, trauma can also influence one's cognitive schemas, the mental frameworks that help individuals make sense of the world. Post-trauma, these schemas may become more negative or pessimistic, affecting their self-esteem, trust in others, and outlook on life. Post-traumatic growth. On the flip side, the struggle with a traumatic event can also lead to post-traumatic growth. Post-traumatic growth refers to positive psychological change experienced as a result of adversity and other challenges, leading to a higher level of functioning. It does not imply that the trauma was beneficial but recognizes that struggling with a traumatic event can lead to new understandings and personal growth. The areas of growth can include: 1. Appreciation of life. Survivors may develop a new appreciation for life, cherishing ordinary moments more deeply and expressing more gratitude for their experiences. 2. Relationships with others. They may experience improved relationships, appreciating their loved ones more, or feeling a greater sense of compassion and empathy for others who suffer. 3. New possibilities. Trauma survivors may identify new possibilities or a new life path for themselves, discovering personal strengths or finding new meanings in life. 4. Personal strength. They often report feeling stronger and more resilient, realizing they can cope with adversity. 5. Spiritual change. Some individuals report deepening their spiritual lives or experiencing significant changes in their belief systems. However, it's important to note that post-traumatic growth and suffering can coexist. The process of growing does not negate the pain and distress caused by the trauma. Post-traumatic growth involves moving forward rather than moving on and leaving the trauma behind. In this light, trauma's impact on identity and personal growth is complex. It can lead to significant distress, alter one's sense of self, but it can also be a catalyst for profound personal growth. The journey after trauma is as unique as each individual, and the paths to healing and growth are diverse and multifaceted. Chapter 6: Structural / Systemic Trauma. Defining structural or systemic trauma. Structural or systemic trauma refers to the psychological harm and chronic stress resulting from living within systems of oppression or inequity, such as racism, sexism, homophobia, or poverty. Unlike personal trauma, which is often the result of a singular or repeated event experienced by an individual, Systemic trauma is a collective experience that affects marginalized or oppressed groups at large. These forms of trauma are embedded within the societal structures that we inhabit. They manifest in the policies, norms, and institutions that perpetuate discrimination, bias, and inequality. Systemic trauma can be subtle, covert, and normalized to the point where those subjected to it, and even those observing it, may not always recognize its presence or its harmful effects. Yet, the impact on those affected can be profound, leading to adverse health outcomes, increased risk of personal trauma, and an overall reduction in quality of life. Structural or systemic trauma often intersects with historical and intergenerational trauma, particularly for communities that have faced long-standing oppression. For example, the systemic trauma experienced by indigenous peoples or Black communities is inextricably linked to the historical trauma of colonization or slavery. The concept of structural or systemic trauma challenges us to consider the broader socio-political context in which trauma occurs. It shifts the focus from individual pathology to social injustice and prompts us to question how societal structures contribute to trauma and how we might work towards more equitable systems. In the following sections, we will delve deeper into various forms of structural trauma and their impacts, as well as potential strategies for systemic change and healing. Case studies: racism, sexism, homophobia, etc. Racism. Systemic racism is a pervasive form of trauma that significantly affects individuals and communities of color. A poignant example is the experience of African Americans in the United States, where the structural racism manifested through disparate outcomes in criminal justice, housing, education, and healthcare can create a constant state of fear, anxiety, and stress, contributing to traumatic responses. For instance, consider the case of a Black teenager growing up in an urban neighborhood, over-policed and under-resourced. The constant threat of racial profiling, combined with economic instability and limited access to quality education or healthcare, leads to a chronic state of hypervigilance and stress, contributing to a state of systemic trauma. Sexism, too, can inflict systemic trauma. Women and girls worldwide navigate systems that often diminish their value, restrict their opportunities, and expose them to harm. A case in point is the pervasive gender wage gap, which not only limits women's economic power but also signals a societal devaluation of their work, contributing to chronic stress and feelings of worthlessness. Consider the case of a woman consistently paid less than her male counterparts despite equal qualification and performance. This persistent inequality can lead to feelings of disillusionment, frustration, and diminished self-esteem, indicative of systemic trauma. Homophobia. LGBTQ+ individuals are also victims of systemic trauma through homophobia. Laws that deny LGBTQ+ individuals their rights, societal attitudes that stigmatize them, and the threat of violence and discrimination can all contribute to a state of chronic stress and fear. Consider the case of a young gay man living in a community where homosexuality is not only stigmatized but criminalized. The constant fear of exposure, rejection, or violence can result in a state of chronic fear and stress, a clear instance of systemic trauma. These case studies exemplify the pervasive and insidious nature of structural trauma. They underscore the need to challenge and change these harmful systems while providing appropriate support to those affected. In the next sections, we will explore the mental and physical health effects of structural trauma and the potential paths to healing and change. Intersectionality and trauma. Intersectionality is a term coined by law professor Kimball Crenshaw in 1989 to describe how different forms of discrimination can interact and overlap. For example, a person can experience discrimination based not only on race but also on gender, sexuality, class, disability, and other aspects of their identity. When it comes to trauma, this intersectionality can have profound implications, as the stresses and challenges associated with each form of discrimination can compound and intensify each other. In the context of trauma, intersectionality means acknowledging and examining how different forms of systemic oppression interact with each other and contribute to the complexity of an individual's traumatic experience. A person's identity does not exist in isolation. Instead, multiple social identities intersect at the micro level of individual experience to reflect multiple interlocking systems of privilege and oppression at the macro, social structural level. Consider, for example, a black woman. She does not experience race and gender separately. Instead, she experiences them together in a way that is unique to her. She may face sexism differently than a white woman and racism differently than a black man. Her experiences with racism and sexism can compound, leading to unique challenges and forms of discrimination, a concept Crenshaw termed intersectional oppression. The stress, fear, and challenges brought on by these intersecting forms of discrimination can be traumatic, leading to adverse mental and physical health outcomes. The compounded trauma faced by individuals at these intersections can be more complex and difficult to navigate, necessitating an intersectional approach to trauma-informed care and social justice. Therefore, to understand and address trauma fully, it's crucial to consider intersectionality. Recognizing the interconnected nature of social categorizations such as race, class, and gender as they apply to a given individual or group, regarded as creating overlapping and interdependent systems of discrimination or disadvantage, is essential. It enables more nuanced and effective support for those affected by trauma, challenging the systems of oppression that contribute to it. In the next section, we will explore how systemic trauma affects health and well-being and discuss potential solutions and treatments that acknowledge and respect intersectionality. Chapter 7: Trauma and Resilience. Defining and understanding resilience. Resilience is a term used to describe the process and outcome of individuals effectively adapting in the face of adversity, trauma, tragedy, threats, or significant sources of stress. It involves bouncing back from difficult experiences and also bouncing forward, growing in the process. Resilience is not a trait that people either have or do not have. It involves behaviors, thoughts, and actions that anyone can learn and develop. The ability to become resilient is not necessarily inherent. It can be learned, cultivated, and strengthened over time. Understanding resilience requires us to shift our perspective on trauma and adversity. Rather than focusing solely on the negative impacts of traumatic events, a resilience-oriented perspective encourages us to also consider the potential for growth, change, and adaptation in the face of these experiences. Resilience doesn't mean avoiding or being untouched by hardship. It means having the ability to utilize available resources, internal and external, to cope with, adapt to, and potentially even be strengthened by adversity. The stress and pain of the traumatic event are not denied or diminished, but individuals demonstrate resilience when they can face adversity, navigate it, recover from it, and continue to develop and grow. It's important to note that resilience isn't just about individual actions and attitudes, it's also shaped by our relationships, communities, and societies. Supportive relationships, strong community connections, and robust social services can all enhance resilience, helping individuals and communities withstand and recover from traumatic events. Conversely, systemic barriers and social inequities can undermine resilience, making it more difficult for some individuals and communities to bounce back from adversity. In the following sections, we will delve deeper into the factors that contribute to resilience, explore the connection between trauma and resilience, and discuss ways to foster resilience in individuals and communities affected by trauma. How communities and individuals cultivate resilience. Individual resilience. Resilience at the individual level often involves personal attitudes, behaviors, and coping strategies. It can include cultivating positive beliefs in abilities. Building confidence in one's abilities and skills can provide a solid foundation for resilience. This self-efficacy can help individuals face challenges with the belief that they have the resources to handle them. B. Adopting a growth mindset. Individuals who view challenges as opportunities for growth, rather than insurmountable obstacles, are often more resilient. They are more likely to learn from their experiences and adapt their strategies in the face of adversity. C. Developing strong problem-solving skills. Being able to effectively think through problems and develop practical solutions can significantly enhance resilience. D. Maintaining social connections. Strong relationships can provide emotional support and practical assistance in challenging times, bolstering resilience. This can involve reaching out to family, friends, or support groups. E. Practicing self-care. Regular exercise, balanced nutrition, adequate sleep, and mindfulness practices like meditation can all strengthen resilience by enhancing physical health and emotional well-being. Community resilience. Resilience at the community level often involves collective resources and shared efforts. It can include building strong social networks. Communities with strong social ties tend to be more resilient. These connections can provide mutual support, share resources, and coordinate responses in the face of adversity. B. Promoting equitable access to resources. Ensuring that all community members have access to essential resources, like safe housing, healthcare, and education, can enhance community resilience. C. Encouraging community engagement. Communities that actively involve their members in decision-making tend to be more resilient. This can increase community cohesion, ensure that resources are allocated equitably, and build a shared sense of purpose. D. Fostering a collective narrative of resilience. Communities that share stories of resilience, narratives that highlight the community's strengths and its ability to overcome adversity, can strengthen collective resilience. Remember that the goal isn't to eliminate or deny the impact of trauma, but rather to find ways of understanding, managing, and moving through it. In the next sections, we'll explore how resilience can influence the trajectory of trauma and examine various strategies for fostering resilience in the face of both personal and collective trauma. Case studies of resilience in the face of trauma. Personal resilience. The story of James. James, a war veteran, experienced severe trauma during his time serving in a conflict zone. On return to civilian life, he suffered from post-traumatic stress disorder, PTSD, characterized by vivid nightmares, severe anxiety, and social isolation. However, over time, with professional support, personal commitment, and a network of support from family and peers, he began to regain control over his life. James's resilience was rooted in his willingness to seek help, his openness to therapy, and his determination to apply the coping strategies he learned. He also found solace in peer support groups, where he could share his experiences and learn from others facing similar challenges. James's story underscores the power of professional help, self-care, and peer support in fostering resilience. Community resilience. The town of Greensburg. In 2007, the town of Greensburg, Kansas, was devastated by an F5 tornado that destroyed 95% of the city. However, instead of succumbing to the disaster, the community decided to rebuild their town with a focus on sustainability and resilience. They worked together to create a town that was even better than before, with energy-efficient buildings, a wind-powered electricity grid, and numerous community resources to support health and wellness. This collective effort exemplified community resilience. Despite the extensive trauma and loss caused by the tornado, the community pulled together to rebuild. Their resilience was reflected in their shared vision, mutual support, and collective action. Cultural resilience. The Maori people of New Zealand. The Maori people, the indigenous Polynesian people of New Zealand, have faced numerous adversities, including colonization, loss of land, and cultural assimilation policies. Despite these challenges, they have managed to preserve and revive their language, culture, and traditions. This cultural resilience is rooted in collective efforts to reclaim and protect cultural heritage, pass down traditions and language to younger generations, and fight for indigenous rights. It demonstrates how a community can draw strength from its cultural identity to resist systemic trauma and promote healing and growth. These stories highlight how resilience can manifest in different contexts, from individuals dealing with personal trauma to communities and cultures facing systemic adversity. They offer valuable insights into the strategies and resources that can support resilience, paving the way towards healing and growth in the face of trauma. Chapter 8: Healing from Trauma. Therapeutic approaches to trauma, therapy, medications, alternative treatments. Healing from trauma is a highly individual process that often requires a multifaceted approach. Each person's journey will be different, and what works for one person might not work for another. However, research has highlighted several therapeutic approaches that can be effective in addressing trauma. Psychotherapy. Psychotherapy, or talk therapy, can be incredibly beneficial for individuals dealing with trauma. Techniques such as cognitive behavioral therapy, CBT, and eye movement desensitization and reprocessing, EMDR, have been shown to help people process and cope with traumatic experiences. CBT helps individuals understand and change thought patterns that lead to harmful behaviors or emotions, while EMDR focuses on changing the way traumatic memories are stored in the brain, making them less powerful and distressing. Medications. Certain medications can be helpful in managing symptoms of trauma-related conditions such as PTSD. For example, selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, which are types of antidepressants, have been found to be effective in treating PTSD in some people. Alternative treatments. Some individuals may find relief from trauma symptoms through alternative or complementary treatments. This can include methods such as mindfulness practices, yoga, acupuncture, or art therapy. These methods can help individuals reconnect with their bodies, reduce stress, and process trauma in a nonverbal way. For example, trauma-informed yoga can help individuals develop a greater sense of connection with their bodies, increase their physical self-awareness, and promote relaxation and stress reduction. Group support. Group therapy or support groups can also be beneficial for those healing from trauma. These settings provide a safe space where individuals can share their experiences, learn from others who have faced similar challenges, and build a sense of community and mutual support. Each of these approaches has its strengths, and often a combination of therapies may be most effective. It's important for each person, in consultation with their healthcare provider, to find the approach or combination of approaches that works best for them. In the following sections, we will delve deeper into these therapeutic approaches, exploring how they can promote healing and resilience in the face of trauma. Community healing practices. While individual healing is an important aspect of recovering from trauma, Community healing practices also play a crucial role in addressing collective and intergenerational trauma. These practices often involve communal activities, cultural rituals, shared narratives, and collective action aimed at fostering mutual support, communal resilience, and collective healing. Shared narratives and storytelling. Communities often use shared narratives and storytelling as a form of healing. This process allows individuals to share their experiences, validate their feelings, and collectively process traumatic events. Storytelling can foster empathy, create bonds among community members, and generate a shared understanding of the community's history and experiences. Cultural rituals. In many cultures, rituals play a crucial role in community healing. They can provide a structured space for expressing grief, honoring losses, and coming to terms with traumatic events. Rituals can also reinforce cultural identity and continuity, fostering resilience in the face of trauma. Community-based mental health services. Community-based mental health services are another important aspect of community healing. These services can include therapy groups, peer support programs, and community mental health clinics that offer culturally appropriate mental health care. These services not only provide essential support to individuals dealing with trauma but also help to reduce the stigma associated with seeking mental health care and create a culture of empathy and understanding within the community. Collective action. Communities can also promote healing through collective action. This can involve efforts to address the systemic causes of trauma, such as advocating for social justice, fighting for policy changes, or working to create more equitable and inclusive communities. Holistic and integrative approaches. Many communities adopt holistic and integrative approaches to healing, recognizing the interconnections between mental, physical, spiritual, and community health. These approaches can include a wide range of practices, from traditional healing methods to contemporary holistic therapies. Each community will have unique healing practices, often shaped by cultural traditions, shared experiences, and local resources. Regardless of the specific practices used, the underlying principle of community healing is the recognition that trauma is not just an individual experience. It impacts and is impacted by the broader community. Therefore, healing must also involve the community as a whole. In the next sections, we will delve into these community healing practices in more depth, exploring case studies and examining how they contribute to resilience and recovery from trauma. The role of social support, activism, and policy in trauma healing. When dealing with trauma, the surrounding environment, composed of personal relationships, community networks, social movements, and public policies, can play a vital role in an individual's healing journey. The interplay of social support, activism, and policy can foster resilience, promote recovery, and even help prevent further trauma. Social support, including family, friends, and community networks, can provide emotional and practical assistance to those dealing with trauma. It can also help to alleviate feelings of isolation and loneliness that often accompany traumatic experiences. This sense of being understood and cared for can be a source of strength and hope, providing the emotional foundation needed for healing and recovery. Activism plays a significant role in healing from trauma, particularly in cases of collective and systemic trauma. Activism allows individuals and communities to reclaim agency, working proactively to change the conditions that contribute to trauma. It provides an avenue to channel feelings of anger, grief, and helplessness into constructive action, fostering a sense of empowerment and hope. Through activism, individuals and communities can challenge injustice, fight for change, and work towards a more equitable and just society. This can involve various actions such as community organizing, participating in demonstrations, advocacy work, and public education. Public policies can have a profound impact on trauma healing by shaping the social, economic, and political conditions in which individuals and communities live. Policies can influence access to mental health services, the quality of these services, and the social determinants of health, such as housing, education, and income. Progressive policies can support trauma healing by ensuring that mental health services are accessible, affordable, and culturally appropriate. They can also work to address the systemic issues that contribute to trauma, such as inequality, discrimination, and violence. Moreover, trauma-informed policies that recognize the widespread impact of trauma and seek to actively prevent re-traumatization can transform institutions and systems, making them more supportive and healing-oriented. In summary, social support, activism, and policy each play a crucial role in trauma healing. They work in concert to provide emotional support, foster agency, and create the conditions necessary for healing and recovery. In the following sections, we'll further explore how these factors intertwine and the practical steps that can be taken to leverage them in trauma healing. Conclusion summary of key points from each chapter. In this comprehensive exploration of trauma, we have journeyed through various dimensions and scales, from personal to collective, from the body's response to the larger societal context. Here, we summarize the key points from each chapter to emphasize the interconnection and complexity of these different aspects. Chapter 1: The Anatomy of Trauma. We defined trauma and explored how it impacts both the mind and body. We differentiated between types of trauma, acute, chronic, and complex, and discussed how memory is affected by traumatic events. We delved into the understanding of PTSD, its causes, symptoms, and potential treatments. Chapter 2: Historical Trauma. Historical trauma was defined and its impact on present communities was explored through case studies, including slavery, the Holocaust, and indigenous genocides. We examined the lasting effects these historical events have on descendants, both psychologically and socially. Chapter 3: Collective Trauma. The concept of collective trauma was introduced and its effects were investigated. This type of trauma affects entire communities or societies, often through experiences like war, pandemics, natural disasters, and societal violence. We also discussed the role of media in shaping collective memory and understanding of these traumatic events. Chapter 4: Intergenerational Trauma. Here, we examined the transmission of trauma across generations, from both psychological and potential biological perspectives. Using a variety of case studies, we provided insight into how intergenerational trauma perpetuates cycles of harm and affects communities worldwide. Chapter 5: Personal Trauma. We ventured into the realm of personal trauma, from accidents to abuse, and how these experiences can profoundly impact a person's life. Through personal narratives, we explored the journey of healing and the transformative power of overcoming trauma. Chapter 6: Structural / systemic trauma. Structural or systemic trauma was defined, highlighting the ways systemic forces such as racism, sexism, and homophobia inflict ongoing harm. We considered how intersectionality plays a role in trauma and discussed several case studies. Chapter 7: Trauma and Resilience. We defined resilience and highlighted its role in overcoming trauma. We discussed ways in which resilience can be cultivated at both the individual and community levels, and illustrated this through various case studies. Chapter 8: Healing from Trauma. This chapter explored therapeutic approaches to trauma, including therapy, medications, alternative treatments, and community healing practices. We highlighted the importance of social support, activism, and policy in trauma healing. In synthesizing these diverse yet interconnected elements of trauma, we have sought to paint a holistic picture that highlights the multifaceted nature of trauma and the multiple paths towards healing and resilience. It is our hope that this book fosters a deeper understanding of trauma, sparks further conversations and research, and ultimately contributes to creating more compassionate and trauma-informed societies. Final thoughts on the importance of understanding and addressing trauma. Our journey through this book has led us through the intricate landscape of trauma, a terrain marked by pain and adversity but also resilience and healing. As we reach the end of this exploration, we come away with the understanding that trauma is not just a personal affliction, but a shared societal experience that intertwines our histories, cultures, and identities. In understanding trauma, we realize that it does not exist in isolation. It is tied to the systemic forces and historical events that shape our societies. It is a reflection of societal imbalances, injustices, and the collective wounds they inflict. Therefore, addressing trauma requires not just individual healing but also societal change. It calls for a reckoning with our past, a challenge to our present, and a commitment to a more equitable and compassionate future. Furthermore, understanding trauma underscores the importance of empathy in our interactions with each other. Every person we meet might be carrying invisible wounds, and every community might be grappling with unseen adversities. Empathy encourages us to be patient, to be understanding, and to extend our kindness even when the reasons may not be immediately apparent. Importantly, addressing trauma also highlights the power of resilience and the capacity of humans to heal, grow, and flourish despite adversities. It speaks to our potential to turn our wounds into wisdom and our pain into power. It inspires us to believe in our ability to overcome and to support others in their healing journeys. As we close this book, we hope that this understanding of trauma informs your interactions, inspires your actions, and influences your perspectives. In the end, understanding and addressing trauma is not just about healing the wounds of the past or present. It is about nurturing a more compassionate, resilient, and equitable world for everyone. It is about fostering a society where every person is seen, heard, understood, and supported. And that is a goal worth striving for. Appendix/resource guide recommended books, articles, organizations, and other resources for further exploration and support related to trauma, PTSD, and resilience. If you are interested in diving deeper into the topics covered in this book or are seeking support for personal experiences with trauma, the following resources are an excellent place to start. They encompass a wide array of mediums and perspectives, providing a robust foundation for further exploration and support. Books 1, 2, 3, 4. 5. The Body Keeps the Score by Bessel van der Kolk. Trauma and Recovery by Judith Herman. Waking the Tiger by Peter Levine. In an Unspoken Voice by Peter Levine. The Deepest Well, Healing the Long-Term Effects of Childhood Adversity by Nadine Burke Harris. Articles 1, 2, 3, 4. Understanding the Impact of Trauma, Harvard Health Publishing. The Lifelong Cost of Childhood Trauma, The Atlantic. Racism's Psychological Toll, The New York Times. Can trauma be passed to next generation through DNA? BBC Future. Websites and online resources. 1. National Center for PTSD, www.ptsd.va.gov. Comprehensive resource for PTSD, including assessment, treatment, and ongoing research. 2. The International Society for Traumatic Stress Studies, www.ists.org, provides a platform for sharing research and resources on traumatic stress. 3. The Trauma Center at Justice Resource Institute, www.traumacenter.org, offers therapeutic services, training, and resources on trauma. 4. Blue Knot Foundation, www.blueknot.org.or, provides information and support for adult survivors of childhood trauma. Organizations: 1. The American Psychological Association's Division 56, Trauma Psychology, www.apatraumadivision.org, focused on the study and application of psychological knowledge and skills to understanding and alleviating trauma. 2. The Trauma Research Foundation, www.traumaresearchfoundation.org, a non-profit organization dedicated to promoting clinical, scientific, and educational projects in the field of trauma. 3. The National Child Traumatic Stress Network, www.nctsn.org, an organization dedicated to raising the standard of care and improving access to services for children and families who experience or witness traumatic events. Remember, it's important to reach out to a mental health professional if you or someone you know is dealing with trauma. These resources are intended to provide a starting point for learning and understanding, but they should not replace professional help.